So today's examination is going to start with the abdominal exam and then move on to the breast and the testes. So I'll be using this gentleman for the abdominal, the gastrointestinal portion. The first thing we're going to do is overall observe his abdomen. Look for any scars, maybe a hernia, any palpations, and he doesn't have any of that at all on his belly. Once we've looked, then we listen. So we will use the diaphragm portion of the stethoscope and listen for hypo or hyper bowel sounds in all four quadrants. He is hyperactive in all bowel sounds. And then we will use the bell and we will check his aortic, his aorta, and listen for any bruits. His renal arteries and listen for any bruits. And then we'll look for his iliac crest on both sides and listen for any bruits. And then feel for his femoral artery and listen for any bruits. None have been found. And then we are going to lightly palpate the belly, feeling for any guarding or any grimacing of his face. Does any of this hurt?
No.
Excellent. So once we have done that with light touch, then we go deeper. And we're feeling for any masses that we can feel in his abdomen. I'm feeling no masses throughout the abdomen. So the next thing we're going to do is we're going to percuss. We percuss all around the abdomen just to get a general feel for how dull or how tympanic everything sounds. First, we're going to feel for the upper and lower edges, borders of his liver. We'll start up here. And it's dull right about here. And then we'll feel up. And it gets dull right about there. So that's about a 10 centimeter area. You should measure it with a ruler. And then you go over to the right to the spleen and way over here in the lateral aspect and do the exact same thing, feeling down. And right about the 6th or 7th rib is where you should feel it. That's where I feel it on him. So his spleen is in the right place. If you could please stand up. Next we're going to feel for where his CVA, we're going to check for any kidney discomfort. Right about here, I'm going to punch right there, punch right there. Did that hurt at all?
No.
And I didn't see any wincing in his body movements. Thank you, Tappan. So the next areas to discuss are the breast and the testes. We'll start with the breast first. Am I in the right place? So the breast, an examination, it's best to do an examination 5 to 7 days after the menses has completed. When we are doing a breast examination for someone else, we have them sit up, hands at their sides. We have them put their hands behind their head. We have them put their hands on their hips and to lean forward to pull out any changes in their breast tissue or appearance. We're looking for any edema, swelling, any contour changes, any dimpling of the nipple, any changes in the areola. We're looking for symmetry between the two breasts, any retraction of the breasts. It would be bad to see an area that might have a whole bunch of dimpling, almost like the peel of an orange. You're going to palpate each breast, including the tail of Spence. The tail of Spence is the upper outer portion of each breast. That's where most masses are found. And to do this, the patient is lying down, and we are starting up at the tail of Spence, and we're going in a vertical pattern. And then we have the patient put their hand down a little bit more while they're lying supine, and we'll start medial near the sternum and go up and down again, feeling with the second, third, and fourth fingers all the way up and down in this vertical pattern until you get to the nipple line. You're also going to take a gloved finger and feel the areola and the nipple and see if any nipple discharge is expressed. That would be a bad thing. And then finally, you're going to inspect the axillary area for any color changes, any rashes, hair changes, swelling, or any masses in this entire axillary area. For a testicular exam, the best time for a male to do a self-examination of the test of his own reproductive system is right after getting out of a warm shower. As a practitioner or as somebody doing the self-exam, typically you would cup the testes and feel with the thumbs for any differences. One larger than the other is okay, as long as it's a normal occurrence for the patient and that there's no pain. When you're inspecting for any lesions. You're feeling for any lumps. You're trying to observe and see if there is any pain. You're asking the patient if there are any issues with urination as well. And also you're palpating the epididymis, which is posterior to the testicle, for any masses. You're feeling for size to make sure that the shape and contours are equal, and normal contours, normal and round, that there's no tenderness or lesions or any thickening as well. Thank you.